Tag TV, and Tag Radio. Technology now has a voice of innovation and information. Get it on www.tagtvonline.com. Reforming the tax system, strengthening healthcare and education, ensuring enforcement of our immigration laws, promoting a 21st century energy plan, and finding transportation solutions for Atlanta. Congressman Tom Price, member of the Financial Services Committee, the Committee on Education and Labor, and the ranking Republican member on the Workforce Protection Subcommittee. This year he was elected by his colleagues to serve as the chairman of the House Republican Study Committee, providing principled, common-sense solutions to all of our nation's challenges. Having received a Doctor of Medicine degree from the University of Michigan and completed his orthopedic surgery residence right here at Emory University, where after nearly 20 years of private practice, he returned to the University School of Medicine as an assistant professor. He became the medical director of the orthopedic clinic at Grady Memorial in Atlanta, teaching resident doctors in training. No surprise that Congressman Price is an outspoken advocate for patient-centered health care reform in Washington. His signature legislation, the Comprehensive Health Care Act, would bring positive changes to provide access for all Americans to affordable, quality health care. Greetings, everyone. It's Tuesday, May 12, 2009, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. Today's focus is the National Health Information Technology System, Health IT, as Tino speaks with Congressman Price on his views as both physician and politician. What's Congress' appetite for rapid healthcare IT legislation, government versus private sector ownership of health IT, and more? Health IT, privacy, priority, and a better care of patients, as Tino speaks with honored Congressman and long-term Atlanta Doctor of Medicine, Tom Price.
Congressman Price, thank you for joining me on Tech Talk.
Great to be with you, Tino. Thank you so much.
And thanks for all the work you do on behalf of Georgia citizens, and we really appreciate that.
Thanks.
Today we're going to focus a bit, if it's okay with you, on health IT, given your background and your commitment to this area. And let me start right out and ask you, as a physician, how did health IT help you better take care of your patients?
Well, as a physician or anybody else in a field that requires a lot of information, the more information you have and the more reliable your information, obviously the more efficient and productive and accurate one can be. So health IT, when we think about it, in the old days, it was just the patient's chart.
Right.
That was IT.
Yeah.
Now the ability to put that in electronic or digital format just makes it that much easier for the individual practicing physician or for the hospital, but also for the communication or sharing of that data. The imperative of being able to share that data across all sorts of different lines is so important. Otherwise, we'll continue to have the remarkable duplication of effort and testing and the like that we currently see in health.
Well, we know you are a real proponent of the Health IT initiative in D.C. With all the other priorities that Washington is facing, is Health IT on the radar screen?
Absolutely. In fact, it's one of those things, one of those areas of the healthcare debate and discussion that receives support from all sectors. So everybody from the far left to the far right understands and appreciates the importance of having accurate information, reliable information, the ability to move that information easily and efficiently. So if there is a common denominator to the health care reform debate, it would be health IT, because of just the simplicity of being able to appreciate and recognize that it is one of the things that can assist in whatever reform is coming down the pike.
So do you have some thoughts on how we do create a national health IT system? Is it a government system or something the private sector should be allowed to create?
Well, I think government has a role, but I think the role is probably, ideally, to decide what the platform is, what kind of, what's the minimum amount of information, what is the commonality of the form that we're going to use for health IT. I don't think that this won't come as any surprise. I think that it would be counterproductive to have it be a governmental system for a variety of reasons, not the least of which is whatever was created at that point in time would likely be what we would see for years and years. There would be the government systems aren't terribly innovative or flexible or nimble. So I think it needs to be a private sector system, but the government's role ought to be making certain that the different IT systems are able to and must be able to communicate with each other so that physicians, clinics, hospitals, labs, all those kinds of things are able to share information when needed and necessary to realize the real efficiencies and benefits of health IT.
Well, this has been a topic for a number of years, but it seems to be gaining momentum in technology. Certainly our listeners, or many of them, are technologists and could play a role in terms of providing a product or service to support this initiative. But how many years do you feel we're away from seeing a national health IT system?
Well, I think it depends on the political will, and it's where your listeners can actually be very, very helpful, having them communicate with their representatives, letting them know, letting their representatives be educated on the wonderful opportunities that are available to us and the wonderful benefits that can come from a national health IT system. And if the political will is there, and if we're able to have some sort of meeting of the minds, then it can happen very quickly. The big question is obviously who's going to pay.
Right.
In this day and age, though, Washington's printing money, so I'm not certain that that's as big a deal as it has been in the past. However, it's important to get a sense for who's going to provide those resources, who's going to own the system. Is it going to continue to be able to be owned by the individual provider, the individual hospital, the individual lab? Those things I think are important, and that's why I believe strongly in the tax credit model as opposed to the purchase model from the federal standpoint.
Well, another issue that seems to emerge when there's discussion around health IT is the whole area of privacy and privacy concerns. What are your thoughts on that in respect to even the pace of making this happen as a national initiative?
Well, it's a huge concern, and every time that we see some system violated or broken into or hacked in some way that we thought was secure, then it gives pause for everybody. Again, I think that's why it's important to have this be a private system facilitated by a governmental definition of what the platform, what the information ought to include, so that it is transferable. In order to make it so that that the privacy concerns can be addressed, it's important, I think, that we have a system that tells patients, tells your listeners, and tells Americans all across this land that they own their own health IT data, that it's not anybody else's, and it requires their active permission in order to be able to transfer it. The encryption of data is obviously you all know, your listeners know so much more about that than I, but it's clearly possible now to do as much as we can to ensure privacy. But these issues are very personal. Health is one of those areas that people aren't interested in, appropriately not interested in sharing their information with folks that they don't want to share it with, and consequently privacy ought to be of the utmost concern, and that's one of the things that ought to be ensured.
We have time for one last question. By the time this radio program airs, the president will have announced an initiative with many of the insurance carriers from around the country that, at least on paper, sounds like it's supposed to keep the costs more in control and maybe allow more people to be able to access health. How do you see health IT playing a role in keeping those costs down? I mean, we talked about that a little bit.
Without a doubt. In fact, I think it's one of the ways that we can truly realize real savings and not imaginary savings in the system, and also
right.
not savings through a rationed type of system that we see in so many other nations. Health IT is one of those things that can be utilized very simply to decrease the duplicative effort and redundancies within the system that aren't necessary. For example, if a patient goes to a doctor's office this afternoon with a cough, gets a chest X-ray, and is treated, later this evening finds that they aren't getting any better, so they go to the emergency room. What happens in the emergency room? They'll go ahead and repeat that test right away, when in fact, if we had an appropriate health IT system, the physician in the emergency room would be able to access that data immediately and be able to tell whether or not repeating that test was necessary from a clinical standpoint, not simply from a standpoint of having the information not available to them. That's just a minor example of how the efficiencies could be gained within the system and actually save money.
Well, Congressman, thank you for joining me on Tech Talk today and for your leadership on this area of health IT.
Thank you so much. Take care.